digital radio,
BBC Sounds,
and your smart speaker.
Play BBC Radio Scotland.
And you're tuned to Good Morning Scotland. Now, doctors will refer patients with possible cancer symptoms more quickly under new clinical guidelines. The changes include referral criteria for people with general but concerning symptoms like fatigue, nausea or weight loss. It's hoped it'll mean more patients are assessed earlier. Well, let's speak now to Samantha Harrison, who's the UK's Strategic Head of Evidence at Cancer Research UK. Good morning to you, Samantha. Thank you for being with us.
Good morning. Pleased to be here.
What do you make of these new revised guidelines?
So we're really pleased to see the new Scottish Cancer Referral Guidance published today, because they will support GPs to identify patients who have a risk of cancer and therefore will require quicker assessment by a specialist or quicker access to investigations. They could also help GPs identify who is unlikely to have cancer so that those patients can be investigated for non-cancer conditions more promptly.
When you include sort of symptoms like fatigue, weight loss and nausea, though, could they not be symptoms of any number of illnesses?
Yeah, so the updated guidelines will now include more information, as you say, with people with what we think of as non-specific or vague symptoms like unexplained tiredness, nausea, weight loss. The updated guidance is actually going to help ensure that these patients are more thoroughly assessed and that GPs are at least prompted to consider cancer alongside other conditions.
What does it mean for patients then that if these, if a GP looks at these, the new guidance and says, well, actually, they do need to be referred a bit quicker because they fall under these new guidelines, what does it actually mean for the patient?
So we hope that this new guidance actually offers a better route into the health system for some patients, and we also hope that for some it will mean their symptoms are investigated and resolved quicker. Ultimately, though, we hope that by introducing this guidance, we actually may help support earlier diagnosis for some of these patients, and we know that an earlier a cancer is diagnosed, the more treatments are likely to be available and the better cancer outcomes might be.
Yeah, because we know that this latest Public Health Scotland data shows that cancer treatment waiting times are currently not good. They're the worst on record at the moment. If you're assessed earlier, does that necessarily mean that you will receive treatment earlier and that will have a better outcome?
So unfortunately, we know that thousands of patients are facing delays to diagnosis and treatment every month, and that is something that Cancer Research UK are urging the Scottish Government to take urgent action on, and this will require significant investment in staff and equipment and reforms across NHS infrastructure. As I said, though, the guidance will offer a better route in for some of these patients, and we do hope that for some patients it will mean that their symptoms are investigated and resolved quicker. In order to see the full benefit of the guidance, though, the government really do need to ensure that cancer services are well equipped so that patients do receive the tests and treatments they need as soon as possible.
So you're going to need to make sure that the entire treatment system is updated so that one part of it doesn't become overwhelmed by more people entering at an earlier level.
Yes, we will really need to see, continued investment in those cancer services so that patients do receive the tests and treatments they need as quickly as they can.
There might be people listening to this thinking, gosh, I've been quite tired recently and I've been losing a bit of weight. Oh gosh, it might be cancer. Should people automatically be concerned?
What we want to ensure is that the public do present to their GPs as promptly as possible. If they feel or see something that isn't quite right for them, is unusual for them, we do encourage them to go to their GPs as quickly as possible. The actual guidance itself is for GPs, and it will help identify and manage symptoms that can sometimes be trickier to recognize and refer, so that for some patients that will mean that they are referred to test more quickly, and for others they may be reassured to know that it's unlikely to be cancer.
And if perhaps you speak to a GP and the GP doesn't think that it merits referral, would these new guidelines allow you perhaps to ask for a second opinion on it slightly quicker?
So the guidance is clear to help GPs support some of the conversations with patients around where maybe the cancer risk is very low. And there's something that's called safety netting, where the GP can talk to the patient about when to re-present if symptoms are worsening or something isn't going away for them, and they then can continue to think about clinical assessment and onward referral then.
Samantha, thank you for being with us this morning. Samantha Harrison there from Cancer Research UK.
It is 20